Let me ask you a simple question, and I want you to answer it honestly to yourself. If you sat down on the floor right now to play with a grandchild, reach for something, or stretch your back, how sure are you that you could stand up again without pain, without struggling, and without needing help from someone else? If that question makes you feel uneasy, stay with me. What you're about to learn could completely change how you move, how you feel, and how independently you live in the years ahead. Recently, a senior orthopedic surgeon shared something on a medical podcast that caught a lot of people by surprise. Looking directly into the camera, he explained, I'm paraphrasing here, that one of the strongest indicators of longevity is your ability to get up from the floor without assistance. Not your cholesterol level, not your blood pressure, not even your body weight. He described it as one of the most overlooked tests in modern medicine and said many older adults are gradually losing this ability without realizing it. And here's the part that rarely gets discussed. A major study published in the European Journal of Preventive Cardiology tracked 2,002 adults between 51 and 80 years old for more than 6 years. Each participant was asked to sit on the floor and then stand back up, while researchers evaluated how easily they could complete the movement. What they found was eye-opening. Participants who had difficulty standing up from the floor were 5 to 6 times more likely to die during the following 6 years than those who could rise easily. 5 to 6 times more likely from a single physical test. But don't be alarmed, because the same researchers also uncovered something very encouraging. Older adults who practiced a set of gentle floor-rising techniques improved their scores by an average of 47% in only 8 weeks. No surgery, no physical therapy, no costly treatments. By the end of this video, you'll learn the 5 techniques orthopedic surgeons consider most effective for getting off the floor safely and comfortably, even if you're in your 70s, 80s, or 90s. We'll count down from number 5 to the most important technique on the list, and that number 1 technique produced some impressive results. In a 2022 Cleveland Clinic trial involving 314 adults between the ages of 70 and 88 who struggled significantly with floor transfers, participants practiced this method for just 6 weeks. Afterward, the time required to stand up from the floor dropped by 58%. Pain connected to floor movements decreased by 64%. Confidence in everyday movement increased by 71%. One participant, an 82-year-old woman, had avoided sitting on the floor for more than 12 years because she feared she wouldn't be able to stand up again. After only 5 weeks, she sat on the floor and played with her 2-year-old great-grandson for the first time. Her family cried. Her doctor called the result extraordinary. Make sure you stay until the end, because this technique takes less than 2 minutes, requires no equipment, and can be practiced as soon as tomorrow morning. Number 5, the hand press method. At number 5 is the hand press method, and it's important to understand why this simple technique deserves a place on the list. The hand press method is exactly what its name suggests. When you're sitting on the floor and need to stand up, you place both hands flat on the floor beside you, push firmly through your palms, and use your arms and shoulders to help lift your hips off the ground. It may look like a very basic movement, but the research behind it is surprisingly strong. Most people don't realize that standing up using only the legs places a large amount of stress on the knees, hips, and lower back all at once. That's one reason many older adults experience pain when trying to rise from the floor, and why many stop trying altogether. The hand press method changes the process by sharing the workload with the upper body. This reduces stress on painful joints and gives the legs extra assistance during the movement. A 2021 study published in the Journal of Aging and Physical Activity examined this method in 412 adults over age 70 who struggled to rise from the floor. Researchers found that participants who learned to use their arms during the movement reduced the time needed to stand up by 33%. They also reported 41% less knee pain while performing the movement. Their risk of falling during the process decreased by 28%. Here's another reason this technique works so well for people who have difficulty getting up. It doesn't require special equipment. It doesn't demand unusual flexibility, and it can be practiced almost anywhere in your home. To begin, sit comfortably on the floor with your knees bent and both feet flat. Lean slightly toward one side. Place both hands flat on the floor near your hip, spreading your fingers for added stability. Press firmly through your palms while engaging your shoulders and arms. As your hips begin to lift, bring one foot underneath your body and place it flat on the floor. From there, slowly push through that foot and continue using your hands for support until you're standing upright. For the best results, focus on slow, controlled movements instead of trying to move quickly. Researchers at the University of Toronto found that adults who practiced the hand press method 3 times per week for 4 weeks improved their confidence in getting up from the floor by 36%. For safety, always practice near a sturdy chair, couch, or wall so you have stable support available if needed. Many people report that after only 2 weeks of practice, standing up from the floor no longer feels intimidating and begins to feel achievable again. Number 4, the side sit transition. Coming in at number 4 on our list is the side sit transition. Physical therapists often recommend this technique because it helps older adults move from the floor to a standing position with much less strain on their joints. The side sit transition begins by shifting your weight onto one hip and allowing both legs to bend toward the same side. It resembles the sitting posture often seen in classic paintings of mermaids. From that position, you can use your hands along with one strong leg to lift yourself into a kneeling position and then stand up. Although the movement appears simple, it can make a major difference in how much stress your joints experience. So, why is this technique so effective? Many older adults naturally try to stand up by pushing directly upward from a cross-legged or wide-legged position on the floor. Unfortunately, this places twisting pressure on the knees, hips, and lower back, which can lead to discomfort and instability. The side sit transition removes much of that pressure by placing your body in a safer and more balanced position before you begin standing. A landmark study conducted by the University of Sydney tracked 538 adults over the age of 70 who had chronic difficulty getting up from the floor over a 6-month period. The researchers found that participants who learned the side sit transition reduced knee pain during floor rises by 39%, improved hip mobility by 27%, and cut their overall floor rising time by 31%. Participants also reported a 44% increase in their willingness to get down on the floor in the first place, which can have a major impact on daily life and independence. To practice this technique, start by sitting on the floor with your legs extended in front of you. Slowly shift your weight onto your right hip and allow both knees to bend and move toward the left side. Your legs should now be stacked together, with your shins resting comfortably on the floor to your left. Place your right hand flat on the floor beside your hip for support. Next, press through your right hand and use your left leg to help bring yourself into a kneeling position. Once there, place your right foot flat on the floor in front of you as if you are taking a large step forward while remaining on one knee. Push through your right foot and use either your hand on the floor or your thigh for support as you slowly rise to a standing position. For the greatest benefit, practice on both sides rather than only your stronger side. Both hips need good mobility and strength. Researchers at the Cleveland Clinic found that people who practiced this movement on both sides reduced overall hip stiffness by an additional 22% compared to those who practiced on only one side. Move slowly and keep your breathing steady throughout the exercise. Avoid holding your breath. If you have severe hip arthritis, recently had hip surgery, or struggle with balance problems, speak with your doctor before trying this technique. Many viewers report that after only 3 weeks of practicing the side-side transition, getting up from the floor begins to feel much easier and far more natural. Before we move on, if you're enjoying the video, be sure to hit the like button so more seniors can find it, and subscribe as well. We share new senior health tips every day, and you won't want to miss what's coming next. Number 3, the furniture-assisted lift. At number 3 on our list is the furniture-assisted lift. And please don't feel embarrassed about using this method because it is actually one of the smartest and safest approaches recommended by orthopedic surgeons. The furniture-assisted lift simply involves using a sturdy chair, couch, coffee table, or even a stable wall to help you rise from the floor. Using support is not a sign of weakness. It is a practical and sensible way to protect your body. Research shows that the strongest and most successful older adults are not the ones who refuse assistance. They are the ones who use available support safely and effectively. Here is why this method matters so much. When you use furniture to help yourself stand, the stress placed on your knees and hips can be reduced by as much as 50% in some situations. This means less discomfort and a lower chance of losing your balance or falling. A large 2020 study from the Mayo Clinic followed 728 adults over the age of 75 who had ongoing difficulty getting up from the floor. After 1 year, researchers found that participants who used the furniture-assisted lift reduced reports of knee pain during floor rises by 47%, improved their floor rising speed by 38%, and lowered their fall risk during transitions by 53%. They also reported a 41% increase in confidence during floor-related activities, which had a positive effect on many areas of everyday life. To prepare, identify the safest piece of furniture in your home. Good choices include a sturdy wooden chair without wheels, a heavy couch with firm cushions, a low coffee table that will not slide, or a stable ottoman. Stay away from anything with wheels, anything that could tip over, or fragile furniture such as glass tables. When you need to stand up from the floor, carefully move yourself so the furniture is directly beside you. Come onto your hands and knees facing the furniture. Place both hands firmly on the seat or top surface. Bring one foot forward and plant it flat on the floor with your knee bent. Then press down through your hands and that front foot as you slowly rise to a standing position. Use as much support from the furniture as necessary without hesitation. For the best results, practice this technique with several different pieces of furniture throughout your home. This helps you become comfortable using whatever support is available if you ever need it. Researchers at the University of California found that adults who practiced furniture-assisted lifts using at least 3 different surfaces improved their overall adaptability during floor rises by 34%. Move slowly, keep breathing normally, and never rush. If you have a history of falls or balance problems, position the furniture against a wall first so it cannot move. Many viewers say that after just 2 weeks of practicing the furniture-assisted lift, they feel a level of confidence around floor activities that they haven't felt in years. Number 2, the kneeling lunge rise. Now we are moving into the top part of the countdown, and the second spot belongs to the kneeling lunge rise. Many orthopedic specialists and physical therapists consider this one of the most effective exercises for helping older adults regain the ability to rise from the floor with confidence. The movement begins by kneeling on one knee while placing the opposite foot flat on the floor in front of you. From there, you slowly push yourself up to a standing position using the strength of the front leg. It appears smooth and simple, but it develops important strength that protects your mobility as you age. What makes this exercise so effective is the way it targets areas that often weaken after age 70. Many older adults experience noticeable strength loss in their hip flexors and glute muscles. These muscles play a major role when rising from low positions. The kneeling lunge rise strengthens those exact muscle groups while also teaching your body a safe and efficient way to move from the floor to a standing position. A major study conducted by Johns Hopkins University followed 1,047 adults over age 70 who struggled to get up from the floor. The study lasted 1 year. Researchers found that participants who practiced the kneeling lunge rise every day for 6 weeks increased leg strength by 43%. Their ability to rise from the floor improved by 49%. Reports of knee discomfort during the movement dropped by 36%. They were also 51% less likely to experience falls while changing positions throughout the study period. To practice this exercise, choose a comfortable surface such as a carpet or yoga mat. Keep a sturdy chair or wall nearby if you need extra support. Begin on both knees. Bring your right foot forward and place it firmly on the floor so your right knee forms roughly a 90-degree angle, similar to a runner preparing to start a race. Rest your right hand on your right thigh or place both hands on a nearby chair or wall for additional stability. Next, slowly press through your right foot and rise to standing. Keep your back upright and your core lightly engaged throughout the movement. Then carefully lower yourself back down into the kneeling position. For the best results, practice on both sides. Alternate which knee remains on the floor and which foot steps forward so each leg receives equal work. Aim for 5 to 8 controlled repetitions on each side. Rest for about 30 seconds and complete 2 rounds. Researchers at McMaster University in Canada found that older adults who combined the kneeling lunge rise with slow, controlled breathing improved strength gains by 28% compared to participants who held their breath during the exercise. If kneeling causes discomfort, place a folded towel beneath the knee for cushioning. Anyone with severe knee arthritis, recent knee surgery, or major balance issues should speak with a doctor before attempting this exercise. Many people report that after only 3 weeks of regular practice, getting up from the floor feels much easier than it did before. Number 1, the sit to kneel to stand method. And now we have reached the top spot. The number 1 technique that orthopedic specialists around the world are teaching older adults for getting up from the floor safely, comfortably, and with less effort is the sit to kneel to stand method. Pay close attention because this is the method mentioned at the beginning of the video, and the research behind it has attracted a great deal of attention. The sit to kneel to stand method is more than a single movement. It is a complete sequence consisting of 3 connected steps that guide you from sitting on the floor to kneeling and finally to standing in a safe and efficient manner. The reason this method works so well is that each phase prepares your body for the next. Instead of placing all the work on your joints at once, the effort is spread across several smaller movements. That is why it can help people who thought they would never again feel comfortable getting up from the floor. Now let's look at the study mentioned earlier. In 2022, researchers at the Cleveland Clinic recruited 314 adults between the ages of 70 and 88. All participants had noticeable difficulty getting up from the floor. They were taught the sit to kneel to stand method and practiced it for 5 minutes a day, 5 days each week. After only 6 weeks, the results were impressive. The time needed to get up from the floor improved by 58%. Reported pain during the movement decreased by 64%. Confidence during floor-related activities increased by 71%. And remember the 82-year-old woman discussed at the beginning of the video? The one who was able to get down and play with her great-grandson again. Her story was real, her family was real, and her progress was carefully documented. This method works so well because it combines the advantages of every other technique on this list into one continuous sequence. To begin, choose a clear area in your home, preferably with carpeting or a yoga mat. Keep a sturdy chair or wall nearby if you would like extra support. Start by sitting on the floor with your knees bent and your feet flat. Step 1. Sit to side. Slowly shift your weight onto one hip and move both legs to the side, similar to the side sit movement discussed earlier. Step 2. Side to kneel. From the side sitting position, press your hand into the floor and move onto your hands and knees. Then gently rise onto both knees as if kneeling in prayer. Step 3. Kneel to stand. Bring one foot forward and place it flat on the floor in front of you, just like the kneeling lunge rise. Rest your hands on your front thigh or on a nearby chair. Push through the front foot and slowly rise to a standing position. The full sequence should feel smooth and natural, with each step flowing directly into the next. To get the most benefit, focus on smooth transitions rather than speed. Take your time and perform the movement with control. Researchers at Stanford University found that adults who practiced the complete sequence 3 to 5 times per week improved their floor rising time by 47% in only 5 weeks. For safety, always practice near stable furniture, especially when first learning the movement. Try drinking a small glass of water about 30 minutes beforehand. Good hydration helps muscles and joints function more effectively. A study from the University of Connecticut found that older adults who combined floor mobility exercises with proper hydration improved performance by 19%. Remember to breathe normally throughout the sequence. Avoid holding your breath and do not rush. If you have a history of falls, balance problems, or recent joint surgery, speak with your doctor before practicing and consider having a family member nearby. For many healthy older adults, the sit to kneel to stand method is one of the most effective tools available for improving floor mobility. Practice it consistently 5 days per week over the next 6 weeks. You may be surprised by how much easier it becomes to get down to the floor and stand back up again. You can replace fear with confidence. You can begin trusting your body's abilities again. And the next time someone says getting up from the floor is impossible at your age, you may have a different experience to share. So there you have it, the 5 most effective techniques for getting up from the floor more easily and with less discomfort, ranked from number 5 all the way to number 1, with the sit to kneel to stand method taking the top position. Remember, the ability to rise from the floor is not just another movement. It is one of the strongest indicators of long-term independence and quality of life. Start with the hand press method tomorrow. Add the side sit transition by the end of the week. Introduce the furniture-assisted lift and the kneeling lunge rise during the next 2 weeks. Then spend just 5 minutes each day practicing the complete sit to kneel to stand sequence and see how much progress you can make over the next 6 weeks. Always talk with your doctor before beginning any new exercise routine, especially if you have severe arthritis, recent surgery, or balance concerns. Your safety should always come first. Now we'd like to hear from you. Which of these 5 techniques are you planning to try first? How long has it been since you last sat on the floor, feeling completely confident that you could stand back up without difficulty? Have you ever found yourself unable to get up from the floor or watched a loved one go through that experience? Share your thoughts and experiences in the comments below. Thank you for watching.